Welcome back. You're still watching Kaleidoscope on Channels Television. One medical outfit hoping to make a difference is the Marcelle Ruth Cancer Center and Specialist Hospital. Let's tell you more. Established in 2020, the Marcelle Ruth Cancer Center and Specialist Hospital is a one-stop center for the comprehensive treatment of cancer and other special conditions at the purpose-built premises on Victoria Island, Lagos. The team offers the highest standards of care with the latest treatments and technology in comfortable surroundings designed to promote healing. The center provides world-class services with state-of-the-art facilities like radiotherapy center with linear accelerator, imaging center with 64-slide CT scan, 3D mammogram, 3D ultrasound and digital X-ray, 2 modular operating theaters. With the aim to set new standards for healthcare in Nigeria, the Marcelle Ruth Cancer Center and Specialist Hospital is hoping to address the existing gap in Nigeria's health sector. The co-founder and CEO Marcelle Ruth Cancer Center and Specialist Hospital, Modupe Elebute Oduse, speaks to us about her mission and her plans. I know you have a passion for research, but tell me what inspired the Marcelle Ruth Cancer Center and Specialist Hospital, and is it all about cancer?
To be honest, the main thing that inspired this was a desire to come back home. I went to medical school here, left in 1986, and I've spent over 30 years in the United Kingdom doing postgraduate studies in both internal medicine. So I've got a qualification in as a fellow of the Royal College of Physicians, as well as in hematology, fellow of the Royal College of Pathologists. But all the time through my journey, learning and being exposed to the best possible care for patients in different aspects of my training, I've always thought that it would be amazing to come back, to bring that back here, home, and look after patients here. So that really is the crux of it from my personal point of view. But of course, as you know, when you said being passionate about research, whilst doing that research, whilst thinking about what is it that we need here, what is the gap, or what are the gaps really in healthcare, it became clear that it wasn't just about hematology. That's my main specialty, hemato-oncology, looking after patients, from as simple as iron deficiency to as complicated as leukemia and lymphomas. But that actually there was a need to provide care for patients with a number of chronic conditions, really, diabetes, hypertension, as well as cancer, solid tumors, including breast cancer, colon cancer, and so on. And that's how we got here, really. And in terms of thinking through what we should do and how we should do it, sort of brought with me a number of people along the journey who provided some inspiration and guidance with regards what we should do. Our main ethos, our main hope, and the main conception really was to provide international standards of medicine in the one place, a one-stop shop, so that when patients walk in through the door, whether it's about coming for screening, wellness checks, annual wellness checks, which we provide under our concierge service, going through making a diagnosis, or patients who are already diagnosed and just coming to seek treatment, having all their investigations, blood tests, imaging, and then, of course, treatments, transfusions, infusions, chemotherapy, as well as, obviously, the radiotherapy, which is unique in the private sector here. Everything is available here in one place.
And talking about bridging the gap in the health sector, I mean, we see medical tourism being a very serious issue right now. How will your operations be helping bridge that gap in the health sector?
I think we're already doing that. We only opened our doors in December. And actually, our model was we were not going to have any inpatients for about 6 months because we thought it was going to be an expensive thing for us. But actually, within 3 days of opening, we began to actually receive referrals and patients. And if, one thing, if COVID hasn't taught us anything, it's taught us the fact that it's difficult to leave the country to go and seek, whether it's education for your children, whether it's healthcare, whether it's just traveling on holiday. We're in a different place. We're in a different world now. And I think that any organization that is able to allow us to be self-sustaining, that's where we need to be right now. Actually, interestingly, this week we've had patients who have actually come straight from high commissions where they were trying to leave to go abroad to go and get treatments, actually come here because it's difficult. I mean, we see what's going on now with this potential third wave of COVID. In the countries that patients typically go and get health care. I think so we're quite excited about that, really.
And how would you be using technology to aid your operations at this center?
So we've invested quite heavily in state-of-the-art medical equipment, diagnostic equipment, as well as equipment to treat patients. So going from, we have a fully operational laboratory, which where we can test for a whole range of blood tests to help make a diagnosis. And from an imaging point of view, we've got 3D ultrasound scan, we've got digital X-ray, we've got I think the most high-tech, state-of-the-art mammogram, which is something actually our ladies are already quite happy about because it's got something called a tomogram in it, and the patients now are able to guide how much pressure they put on whilst the images are being taken. So it's much more comfortable for patients. And actually, because they are in control of how much pressure they're putting on themselves, we find out the images are better, because they know what they're expecting. We've got a 64-slice CT scan. And our CT scan is not just for diagnosis, it's also to help the linear accelerator treat patients with radiotherapy. And then, of course, we've got a radiotherapy machine, a TrueBeam, which is the 5th in West Africa, and the first in West Africa, and the 5th in Africa, bringing state-of-the-art radiotherapy to patients. So here we are able to provide patients with not just the medical treatment, chemotherapy or transfusions, infusions. We also do surgery. We've got 2 modular theaters kitted with state-of-the-art equipment. And in particular, I'm very, very keen, as you said earlier on, about research and about teaching. So we've got one of the theaters where there is audiovisual equipment that's linked to a seminar room where people can sit in the seminar room, surgeons, students, can watch the surgeon, can hear what the surgeon has to say, and they can be taught without actually being in the room. So, yeah, we've I think, tried our best, really, to bring the best possible diagnostic and therapeutic equipment here to treat and look after patients.
Talking about staff, do you source for them locally or you outsource?
I'm very proud to say that we're fully Nigerian owned, mostly Nigerian staffed, apart from 2 expatriates to run the radiotherapy machine because, as I said earlier, it's the first in the country. The rest of our staff are all Nigerians. Some of us have spent a lot of time abroad, so like myself had been away. My director of nursing had worked in the US for over 30 years before she came back. Some of our surgeons are people who have trained abroad and come back, but we also have a complement of highly skilled staff who trained here. So we have got a combination of the 2. I think we've built up quite a good set of staff. We've got over 40 staff in the building who are all well trained to look after patients. And for us, that patient-centered care being delivered by the right skill set with compassion and speedily is quite important to us.
You're passionate about giving back, that I know, from medical school where you helped set up a sickle cell club in Lagos. You're the grand patron of Build Africa and a trustee of Walkabout Foundation. You must have plans to give back to society.
Actually, I've been giving back for a long time. I left medical school when I was 21, so I've been involved with a number of non-governmental organizations for most of my career. And I've done it not just in medicine, but in education. So Build Africa builds schools in Uganda and Tanzania, in rural areas, not in the cities. And that's what we did that for quite a long time. And in the end, we actually had over 100 schools that we built and funded. So giving back is something that, for me, I think, you know, if you're blessed enough to do what you want to do, if you're blessed enough to achieve even probably more than you ever thought you would achieve, then obviously it's easy to realize that you have to consider giving back. With regards to what we're doing here, we've already set up a foundation, the Marcelle Ruth Foundation, which in the future will be available to try and provide care for patients who are not ordinarily able to afford care. Because cancer care and also care of chronic conditions is expensive. It's expensive because the diagnostics, the equipment are expensive. It's expensive because the drugs that we use are quite expensive. And in particular with cancer, we have moved away from just using chemotherapy agents, which are quite toxic to people. We're using drugs that are more targeted so that we're limiting the side effects. But those drugs come at a cost. So we're very acutely aware of that. But apart from what we hope to do, I'm pleased to see that already in the country, there are a number of non-governmental organizations that are very focused on trying to help. The other set of people who are very keen to help are the pharmaceutical companies themselves, who are already working with one or two of them in particular conditions to provide drugs for those patients who cannot ordinarily afford them. So there's a lot of work that is being done. There's much more than we can obviously do. And looking forwards, our aim and our hope is to try and make sure that a wider range of patients can afford care. And we will be doing a lot of work ourselves and together with other bodies to try and ensure that we provide the corporate social responsibility that's needed to provide that for patients in the country.